and I'd like to call this meeting to order at 10 o'clock. Less 5 seconds.
The live stream comes down first, that's why you hear it.
Oh, okay.
Oh, you're 10 o'clock.
Okay, we're 10 o'clock now, so everything's working. This meeting is called to order at 10 o'clock. First item on our agenda is to accept the minutes from last month's meetings. Moved, seconded. Moved by Sam, seconded by Jim. All in favor? Aye. Passed. Okay, now, departmental requests and reports. And does this usually have someone come up?
Mr. Switch will be happy to come up and take the hot seat.
Great, here we go.
Morning, everyone.
Morning. Morning.
I don't want to take up too much time. I actually meant to do this last meeting and unfortunately got pulled into a bit of a crisis, but wanted to kind of update everyone with the Veterans Department and a little transition with our manpower. Josh Worthington here is our new hire.
Nice to meet you guys.
Our newest VSO and recently accredited by both New York State and Department of American Legion. Been on the job for right now about 2 months.
Yeah, a little over.
In Greenwich.
Yeah, from Greenwich.
We're sorry to hear that.
I'm not. Me too.
With that transition and everything, it's put a little bit more strain on the traffic and work processes through the office, but I just wanted to provide that update and let everybody know and give a face to the name. Michael Alexander, who is the deputy director, is still within a VSO type role. He's transitioned now and works with New York State at both the SUNY ACC campus and the Saratoga campus. But he'll be kind of popping in and out of the office, working in conjunction with us, basically doing the same thing at the state level. So being able to continue to work shoulder to shoulder with him is definitely going to strengthen our ability to serve the veteran community. That's it. And any questions or anything?
So, talked about vehicle fleet and managing the turnover, so that we can replace.
Okay.
Just something to put in the back of your mind as you kind of do planning is how we can best offset the changeover, so we're not replacing everything at once. Remember how we got
Right.
the upgrade on the fleet there? It's a little bit about fleet management, and just seeing if we can figure out a way to think about when we need a new van. And we can offset that, so we're not having to buy 2 new vans every
the same time.
whatever years at the same time. That might be helpful.
I think we were talking about the fact that we did get 2 new vehicles put in service at about the same time. You want to use one more than the other, or let one be more depreciated over time.
Yes.
So we can not do it well.
Absolutely. The problem that we come across is how many veterans have to go in different directions with their appointments, but try to mitigate that as much as possible and work with the carpool as well to see if we can think of some better ideas, good ideas to try to keep the maintenance costs as low as possible.
Well,
It's not the usage as much as the planned replacement.
yeah,
The time,
yeah.
not at the same day. not at the
You're
same-
right.
Something to think about. If we can offset it by a year, we can extend the life of one van. Maybe get a replacement early or whatever, just to offset it. Something to think about so we can kind of even out those costs.
Absolutely.
Thank you.
We just have to avoid you coming to us and saying, well, you can't get one this year because you got one last year.
Okay.
Okay, and that sinks your whole plan.
We would never do this.
All right, we have an
Thank you very
advocate.
much.
Thank you. We have an advocate at the state level.
Now, we're probably moving on to all the shiny sunshine news. Leap.
Oh,
Yes.
you're doing great.
Good,
Are you?
I am. Happy to be here. Oh, yeah. Did this yesterday too. Oops. Sorry. Think I got everybody now?
Yeah.
Nope. All right. Nice to see you all. Thank you for having me. I am here to report on our, as I do quarterly, on LEAP's contracts with Washington County for the food pantry. We received funds from Washington County to support our food pantry, and also on transportation. This with the Office for the Aging. We have that transportation contract. So what you have here in front of you is the first, we'll do the food pantry first. The first page is quarterly ending in December, because I normally would have reported in January. It fell during the time that I couldn't schedule that, so it came in this month instead. So you have the reports for the calendar year of 2024, and data for specifically for the last quarter of calendar year 2024. You can see that our overall food pantry usage has gone up considerably. It has just been rising steadily. It's been going up consistently. We see new families every month. And on the back of that is, it just continues that by monthly. It's just a monthly assessment of how many new households we see, how many total households, and the number of total individuals each month is what you see there. I asked for some insight from our food pantry manager, what she's seeing and what the experience is, what she perceives the increase is. And she said she's seeing a monthly increase in the number of unhoused families. She's also seeing an increase in single parent households and those on fixed incomes in the Alice range as well. And that some of the problems people are saying that they're experiencing, many families are using multiple food pantries in the county. Because with each one, they're restricted to how frequently they can do it. And if it's a regional food bank pantry, as we are, the amount of food they get is 3 days worth of food for each member in the household. So she said what she's seeing is that a lot of people are depending more and more on food pantries, and that what they're indicating is the rising cost of food and also the rising cost of rent is what is driving them to need assistance more and more. So that's what we're seeing. We had this overall increase, 23% increase from 2023 in our overall usage. And those are the reasons that she's seeing for increase. Any particular questions or concerns or anything? Yeah.
Remind me, what is
Asset limited income constrained employee. It is. It is.
Do you have a feel for the age? Is it used more by seniors? Is it used same as, younger families, or?
I did ask her if she was seeing more seniors, and she didn't indicate that she was. It seems to be more families, single parent households, families on fixed incomes, and unhoused families. That's what she's reporting seeing. We are struggling with as a pantry, as an agency, we're struggling with keeping the pantry stocked. It's of course the rising cost of food affects us stocking the pantry as well. We are a regional food bank pantry, so we buy as much as we can through regional food bank, which saves us. Also through regional food bank, we have a leaning arrangement where we go to Market 32 and get things that they are getting rid of. In the past, that has produced a decent amount of food for us. There was a time when we got meat and deli and that sort of thing. We're getting very little from them now. So we've reached out to Regional Food Bank to try to find out what the problem is. If there is another store we could add to our gleaning schedule, or if there's some, some way they can help us with Market 32 so that we get more. And our first attempts were pretty much, sorry, this is what you got, but we're not stopping there. So we're actually approaching some other stores that we know are, work with Regional Food Bank as well. And we're also still talking to Regional Food Bank, trying to get that fixed so that, because that makes a big difference. The gleaning really helps when it's effective. But for the last several months, it's not been. And so we're working on getting that. We also have, food collection boxes that are going out in different places around the county. There will be one actually in the, staff break room here downstairs in the basement, in March. You'll see it, it's branded, it'll be there, and there will be a flyer, works this, out with Melissa Fitch, there will be a flyer that'll go around, letting county employees know what it's there for and what we're collecting. So, but those are also going in some other places. We have a couple of schools where they're going, a couple of banks, that sort of thing. Any other questions?
Since I'm new, I have a question on.
Yeah.
When someone arrives at the food bank, what's the process they go through? How do you've got good data, do they have to show ID, put them in a database, do they have to qualify in any way?
We serve everybody who comes, but the source of the funding that we use to serve them changes depending on their income level. Okay, because we are funded also through CSBG, the Community Services Block Grant. That's what makes us a community action agency. And with that funding, we can only serve people up to a certain level of the federal poverty line.
And they self-declare where they are on that?
Yes. Yeah. And so we do collect a lot of that data. We actually are in the process of transitioning to a new data management system, which I'm hoping is actually going to give us more robust data on the demographics of the people that we're serving, and some more information like that that'll help us target things a little bit better. We're in that data transfer phase right now. It's been a little bit of a nightmare.
Interesting. And might there also be a drop-off number? If we give the new people and we give the, what? We can't just keep getting new people without the total
Right.
growing.
That's a great idea. I will ask them if they can provide that for me for the next report.
Shelley, do we know how many of those people may be from out of state?
Have come here from out of state?
Yeah, like Vermont. I only mention that because I know I sat one day, we had some place in Fort Inn about that, and I sat there one morning and counted cars that came in Vermont plates on to the food bank at Fort Inn, and there was 11 of them that came in that day. And I just,
I don't think we're serving out of state at our food pantry unless they've recently moved from out of state, because we are restricted to Washington County residents with our funding.
Okay.
Yeah.
I know at one point we talked about the food packaging and homelessness, and how sometimes the food that we're able to give them, they can't prepare or cook because they're homeless.
Right.
And so there was talk about over the New York State Regional Food Bank. Is there any change in food products so that it accommodates homelessness?
Not from Regional Food Bank, but we purchase items that are more suitable for people who are unhoused, living in hotels, things like that.
Has that number gone up?
The overall unhoused number? Some, yes. Yeah. Yeah, it has. That reminded me of something else, and now I've forgotten what it was. Oh, no, I just wanted to update you too that we have, I think I might have mentioned this last time, but in case I didn't, we've also changed the way that we distribute food within the food pantry. It used to be people came in and got a box. We would ask questions about what their likes and dislikes, but now we've changed it so that people can actually select their own items, basically shop pantry. It's one step toward our greater vision for a pantry that allows for more dignity, more personal choice. So we're working toward that. Anything else? All right, the rest of the report is our transportation. So you have 2 pages, but the second page of that actually also shows the data from the first page. This first page is just this last quarter. The top part shows the overall units of service and so forth that we had in our transportation program. The middle portion there is the ADRC OFA piece. The bottom part is CSBG. That is not county contract part. That's our CSBG transportation, those who come to us that don't qualify through ADRC. We still do assist with transportation for others as well. So you can see the totals there for each of those. There was one number that I felt looked strange. Was it? New clients. On the top was 30, in the middle was 28, and on the bottom was 0, and that doesn't add up. So I need to check on that and find out where the two missing are, but it's only 2, and I think it's probably just a typo. And then what you see on the next page is this information, but for the entire year, because we did close out the year of 2024. So you can see the entire year data there, and it's small, I'm sorry, I'm gonna try to do as few pages as I can. We also have, if you ever want to see them, we have client surveys for the transportation. We do send them to OFA as well. I don't print them to bring them here just because it's a lot of extra paper and they're all just, 2 pages each. So, but I'm happy to send them along digitally if you ever want to see the kind of feedback we get, the surveys that we're getting. I'd be happy to share that with you.
There's a category income below 150%. What is the dollar amount of 150% approximately?
That's 150% of the federal poverty level, and I don't remember. It changes based on family size.
Just curious.
Yeah. I don't want to take your time. I will look it up where the federal poverty level is. I don't always remember those numbers.
1,650
For an individual?
for a household of one person.
Okay.
What was that number again?
15,600.
And that's federal poverty level, so
That's federal poverty.
150%, that would be about 22,000.
people's 26, 4 people's 32, 5 people are 37.
0.5, yeah.
That's Brent.
They're so quick, I did that.
Impressive.
My question was for Gina. Gina, are they able to, on an overall basis, meet the transportation needs that they're contracted for?
That is
Is it?
correct.
Okay.
I don't have no concern about.
I only asked that question because several of us on the LEAP board, and if there was an issue with something we needed to supply to LEAP to be able to do that, I wanted to be able to intervene with that. Okay, good.
I have one question. We had a lot of volunteer hours for drivers in the first half of the year. Did we offend them or do we need them?
That is a good question. No, we only have a couple of volunteers and, we do have, actually, we have 5 part-time drivers. We just hired, we have 6 now. We just hired another one because we needed more. So we do have a couple of volunteer drivers and we just use them as needed.
So they're there if we need.
They're there if we need them. Yeah. Anything else? Thank you very much.
Thank you.
Right along. Okay.
Oh.
Is it OFA next?
It is. Someone's in a hurry.
Somebody be great. Must be good news.
Something, right?
Pardon?
I guess you better be quick.
Exactly. Morning.
Morning.
Start by sharing
the invitation to our March for Meals campaign. So March, again, is that time of year when our office highlights the importance of proper nutrition as we age. We do this with our annual campaign called March for Meals. I'm excited to share with you that this year's theme is A Place at the Table, which recognizes the importance of local nutrition programs and the meals being served in communities across the county. When local nutrition programs get to know their program participants and come together over meals, health and well-being are dramatically improved. It also highlights how our nutrition program is truly more than just a simple meal. In 2024, Office for Aging, in partnership with the Sheriff's Office, served 870 older adults with approximately 94,887 meals, which is about 2,333 more meals than the previous year. On Friday, March 14th, we are inviting Board of Supervisors, elected state legislators, the OFA Advisory Council, the media, and select department heads to see the operations of our central kitchen, to enjoy a ride along with one of our seasoned home delivered meals drivers, and or visit one of our senior dining sites. The letter and flyer that I've shared with you today outlines the details of the day's events. And most certainly, if this particular day, March 14th, does not work for any of you, we can accommodate your request at another time. So if you can, I'd love to see you RSVP by March 7th for our March 14th event. Questions?
How many people showed up this week?
We had a great turnout last year. Last year, we were visited by the New York State Office for Aging Director, Greg Olson, and his key public information specialist. And we were able to, along with him, and I believe Assemblyman Simpson was there. I know that Mr. Baker was there. I'm gonna try my memories showing here. But we had a very nice turnout of people, and certainly people that haven't seen the operations. It's truly, I always speak highly about how we operate our nutrition program by having our central kitchen in the sheriff's office. It shows the partnership that we have with another county department, but also just the efficiency of the event as well. It really kind of shows how we have one central kitchen and how we disperse that out to our drivers, who then partake in our 11 home delivered meals throughout the county.
Thank you. Any other questions? Thank you.
I do have a couple of items.
All right.
Miscellaneous. Speaking about National Nutrition Month, I want to give committee an update on the status of our registered dietitian. Last month, I did speak about how our registered dietitian had provided us with a notice to end the contract that we had for RD services. I wanted to share with you that I'm still working with our county purchasing officer for an RFP. But however, right now we have a temporary gap of services that I have a plan to fill, and that's the information I wanted to share today. Our Association on Aging has hired a registered dietitian on staff. And the reason being is because several counties across the state, like ours, is having difficulty finding a registered dietitian to fill the role. And because of that, the Association on Aging offers out the services at no cost to counties. And this right now is my plan to temporarily band-aid the situation, to tap into the association's registered dietitian for specific services like nutrition counseling. And also we have to have an RD sign off on our monthly menus. And so my plan at this time is to tap into the association's RD for those services. And in the meantime, we're gonna fill the other requirements like our site checklist, and things like nutrition education. So to proceed, right now, I'm looking to solidify this with an MOU with the association. And again, I'm still looking to pursue the RFP and hope to truly find somebody that can serve our Washington County residents in person.
Yeah, I was gonna move that as a motion, if in essence.
Second. Yes. All in favor?
Thank you very much. I also have some information about our advisory council that I'd like to share. At this time, there are 2 changes to the advisory council, and I'm not really quite sure how to proceed, but I wanted to bring it to committee's attention and see if any action is to occur. In December 2024, one of our appointed members, Bruce Ferguson, who represented Salem, had passed away. So at this time, we have no representation for Salem. And in addition, we had learned that our appointed member, Val Baez of Granville, has moved out of state. And so at this time, we do have a vacancy for representation in Granville. Both of these terms were to end in December 31st, 2025. So at this time, my goal would be to look at recommendations to fill both of those vacancies.
So we need another resolution.
No, I think
They have
Just,
name?
I think you just need to bring names in.
Sure.
Those go to full board, correct?
Actually, yeah.
Yeah, eventually.
Do you want us to provide names, or do you have a pretty good idea who to contact?
I know people in Granville, but I also welcome any recommendations.
And could you review as a 4-year term and how many, quarterly, monthly?
So thank you for asking. The appointments are for 2 years. And right now, our advisory council meets 4 times a year. Our next meeting or our first meeting in 2025 is going to be this upcoming Monday. So usually the meetings are in March, June, September, and December. We try to spread the meetings throughout the county. If you have somebody that you know that would be interested, I would be more than willing to share with them information about the appointment and what that looks like, as well as some conversation with them as to what their role would look like.
any other questions? Any more info?
Thank you.
Thank you very much.
Hi, I was just testing you before, see whether or not you knew if I was A or C.
Oh, good. Good test, good test.
Good morning, everybody.
Right.
I have a few different things to bounce around with. One, as it says, is a budget amendment request, and I do have a few copies of a budget amendment, but it doesn't actually have any numbers on it. So it is to carry over unspent ARPA funds that we had in our budget from 2024 for foster care and daycare into the 25 year. And this is really a mathematical discussion that's underway between you and I think maybe even Brian too, but also our fiscal to look for you, Al, I'm sorry, the treasurer I'm talking to come up with what exactly needs to be transferred. But in our opinion, we've already spent all of the money, or we've at least determined where it's all going to go, but it's about how it gets pulled down. We need to transfer it over. So I don't have numbers right now. That's something to be finalized before finance.
Yeah, I did have a conversation this morning with the fiscal officer. There's a
On
couple of
another
your
matter.
requests today that I had asked her to respectfully move forward. with the numbers to come to finance, because it would be completely unfair to have you bring a number with 40 minutes notice.
Yes, I have that other thing for last.
Yeah, so there will be a couple of your requests today that will be finalized in finance, and we're gonna move there.
I'll make the motion to move the carryover amount to be
To be recorded in
determined
finance.
to finance.
Right. Seconded. All in favor?
Aye.
Aye.
I think this could be the easiest thing so far.
Oh, don't say that aloud.
Are there dark skies on the horizon?
Yes. Yes, there are actually.
Thank you for that. Also, I attended I had 9 steps to go next. I'm sorry, I am all befuddled. But let's go to the Portland, item. Portland County had, passed a resolution, and I actually had possession of it last month. I shared it to a slight degree. I have some copies of it as well. Essentially what they were doing themselves was advocating for reform and increased funding for the New York State Code Blue program. They spoke within their resolution with the different whereas statements, as to the history, the origin, and then the history of the funding. You did have it, Dan. Debbie, do you have that?
No, I'm not ready.
So it's something that I would recommend us doing, passing something similar to send on to advocate with the state. It's their, what they are asking for was to urge the state to increase the funding commitment to adequately support the continued operation of Code Blue programs and ensure the safety and well-being of vulnerable individuals during cold weather conditions. This other aspect is calling for the establishment of a true partnership between county DSS and other service systems, starting at the state level, that have both the expertise and shared accountability to design the services and space to keep our most vulnerable individuals safe. And really what that is, DSS is always last resort for anything that's needed. In this case, it's about providing shelter, and the level of complexity of the people that come to us under this, essentially an open feeding system of people who are not eligible for other assistance through DSS. It's anybody else that comes to us and says they are homeless. They could have multiple issues, mental health issues, substance abuse issues, have developmental delays, and it pushes all of that, all of those people together into one shelter for in this example, and they do not get the services that they need. So what DSS has been asking for of the state is please bring these other state agencies in to help us serve these people. So that's what that last part is. I think it's definitely necessary. What I would really like to do is work together to come up with, if you support us developing something, work together with Dan to refine what we would put in it for our sort of meat and potatoes, because I also am a strong believer in there needs to be regulations that these folks have to abide by to be able to continue to stay in the shelters. And currently they can be combative. They can disregard any of the rules of the shelters, and we are still required to provide them shelter. So I would like to also urge that the state do something along those lines, and that is not in this resolution. So I'd like to refine what I would recommend we do and bring it back next month if this committee is interested in doing that.
I mean, if they increase the amount they're going to give, does that increase our match? We have a match that goes in.
We do not have a match on this one
Gotcha.
yet.
But if they add other things to that, that might indicate to match it.
Other services,
Services like you were just talking about, because it probably goes on different parts of your budget as well.
there's always that potential. Yes. Yep.
This is primarily to embrace the Cortland resolution and expand on it.
Acknowledge that, yes, Cortland has done one. It's been provided to all of the commissioners within the state. I support it. I think that we should do something along these lines. Code Blue is an area that started as an executive order. It was, very suddenly thrown together at that time, and over time, since it has not been truly refined in any way to give guidance, it's really just the requirement. And it has, as it has become more well-known by people within the community, it has had additional issues that have come with it.
Chairman, I'll move that to do a motion to a resolution to the agency itself. It would be listed also to the elected officials.
So moved. We have a second? Nate? All in favor?
Aye.
Well, we're not, what are we doing? We're voting on the resolution, what to add to it.
I've got a question.
Oh, I'm sorry.
Mike, I just wanted to ask, Tammy, if you wait to the next meeting, the resolution will pass after the budget's already been adopted. Is there a way that we can get something to
Okay,
committee to get it
sure.
through?
Absolutely.
Right, because if we wait till your next meeting, it will pass in April.
Yes, my thought on it, Al, was,
Which
was that-
might be okay with you. But
I was thinking that Code Blue is gonna, obviously Code Blue may also, let's say that next meeting, we're no longer in the 32-degree bracket and we don't have that obligation any longer. That was what my thought had
But we
been.
wanted to advocate for
But it would
this
be
budget.
coming back, but yes, you're right, for this budget. I do want to share with you, NISAC has passed some resolutions.
Correct.
And so among that is for increased funding for Code Blue.
Right.
As well. That one is also, I think probably gonna be distributed to the counties and could also be adapted by our county to send out.
If you had one to the county attorney that they saw in their packet, it could get passed at the March meeting. Yeah, ahead of the budget passing. So I'm just asking about.
I've got this resolution. Initially, it was just a matter of changing.
She wants to add another.
Right, I know, that's what I'm saying.
Be
If it was just a
resolved,
matter of
right?
changing Cortland County to Washington County, County Legislature, Board of Supervisors, it'd take me 3 seconds, but we would add something.
If we wanted to use in this budget cycle, is my question.
So I guess, Chairman, that based on the comment from Supervisor Hogan, if there's anything she's gonna add to it, then I could withdraw my.
We'll
Yeah.
wait to pass a motion or have a file a motion next when we have this board.
So do you want me to get it into some other committee for review before the March board meeting? Is there another committee that you'd want to see it? Is that what you were thinking, Treasurer?
I was just
Fine.
asking if you wanted to get ahead of this budget cycle, or if you don't care when you advocate.
I guess the question is, do we support a resolution like this with some additional whereases based on some of the comments you made, reflecting some parameters
Yeah.
to the program, recommended parameters to the program? I would support that. If the methodology is to get it put together and reviewed legally and then present it to another committee, perhaps finance, before the March board meeting, that I would be.
Well, if you come out of this committee and then you'd see it in the packet, right? You would pass it in the way that you just mentioned. But if you'd rather actually see the final draft through a committee, you can absolutely do that. I'm just saying, there is a way to get it in the March meeting if you choose.
The other thing we've done, we had a couple of resolutions for this past meeting last week where they were sent to the board at the kind of last minute that they can review as well.
Right.
Give it to you ahead of time before you see it.
Most everybody here is also on the finance committee, so I don't know if you wanna. I'm with Sam. I'd like to see the whereases, before we move.
I'd be remiss if I didn't ask about the timing, that's all.
Yeah. I'm happy.
It's a
to
valid
entertain-
point.
I'm happy to entertain it in finance. Depending on what everybody else thinks.
Well, finance, everybody on the board would pretty much have it. The knowledge of it too.
Yeah.
It's a well pending.
So we need no motion, we just let finance.
I'll take that as direction. If Tammy gets me what other stuff she needs, I'll try to have the resolution ready for the finance committee meeting.
Thank you.
Yeah, I don't expect it to be anything that's, very provocative. It'll be what we've talked about here.
You can avoid using the phrase special housing unit for those folks who have behavioral needs. Like, so,
Would you like me to?
you want to avoid that phrase with the state of New York these days.
Special housing unit or special needs?
Special housing unit. That was you were talking about adding to facetious. You were talking about adding to it for people with behavioral issues in the shelter.
They're already there. What I
I'm
want
saying
is,
you're gonna add something for inclusion.
yeah, they already do have in theirs the, speaking to, detail about the other agencies that also need to service these people. And I'm not necessarily saying that they need to be pushed in for services into the Code Blue setting, but they need to provide them services, period. That might help them stabilize. So I think I can come up with something.
Yeah, it'll be interesting to see how you craft that. Because to Supervisor Hogan's point, there's some nuances to the language that you use to get that through.
Best of luck.
Thank you.
So but what's our control? Do we use the Code Blue shelter over in What's off?
Open Door Mission is where we provide our Code Blue through. If they are either at capacity or we send them someone that they absolutely cannot serve because there has been a previous issue. Or we have a family that only qualifies through Code Blue, they would then be sent to a motel. And then we do draw down Code Blue funds for those motel stays.
Right.
Move on to NISAC. So I am on the standing committee for Medicaid and Human Services, and the NISAC conference was kicked off on Monday by having their committee meetings or subcommittee meetings. So we had 3 resolutions before us. I can just tell you what they're about and ask if you have questions, like after each one of them, if you'd like me to. But just to share with you, and I know that NISAC generally forwards these on to counties. So the first one that we had to consider was urging the governor to become a true partners in addressing homelessness by focusing on rent allowance and standard of need that includes the restoration of 50/50 cost sharing for safety net programs and provide actual brick and mortar solutions by making permanent housing the central focus. Questions on that?
Yeah, 50/50, that's 50 for the state, 50 for the county.
Instead of the current 79/21, it had been 50/50 in the past. I believe it may even still say that in law, but what has been the shift for the last number of years is that 79/21. The second one is urging the governor and the Department of Health to continue to pursue a federal 1115 waiver to allow justice-involved adults and youth to be enrolled in Medicaid and CHIP 90 days before an eligible person's expected release from incarceration. This is something that was supposed to, or they were advocating to have it included in the 1115 waiver last year. It would be a matter of putting there being Medicaid coverage for people in our jails, and the prisons, any of the places that youth are held, to be able to allow them to have the linkages put in place for them to immediately get services for mental health or physical well-being, whatever the case is, upon their release, instead of having to wait to get it, and then the chance of them having a worsening condition or overdosing or something of that nature.
So how would the sheriff monitor that, based on they're incarcerated, but he still has responsibility to see if they get the medical treatment that they need? How would that, if they can have up to 90 days before they're actually separated?
I think that in our instance, the sheriff is monitoring what they need anyway, but it would then be chargeable to Medicaid.
So that would probably reduce, well, in theory, it should reduce his budget, some will increase in yours. If you can try to protect.
Increasing the cost of Medicaid, yes. Yep. The third resolution is urging, and this is related to the current budget proposal that's been put in place through the executive budget to restore funding for the Triple FS program, which is the Flexible Fund for Family Services, to the previous year's level, and to increase state support for Code Blue by 20 million above the amount provided in the governor's proposed 26 budget, to ensure critical services can be provided in Code Blue shelters. Speaking about the fact that over the last 15 years, the state has devolved away from its historic and constitutional responsibilities of providing social services and support for low-income families and children, as demonstrated through significant reductions in state financial support for these programs, thereby shifting state costs and responsibilities to counties in New York City. So, speaks for itself.
How was the $20 million number arrived at?
Because that is what it's currently funded at, and so they're saying that it should be done.
So just a double.
Yes, yes. There is another resolution that was going through the board of directors that speaks also to disproportionate funding cuts that impact Medicaid and other programs within DSS, as well as other programs within the county. That got pulled from our committee, and it's going to the full board, so that would be something else I would anticipate would be coming.
Okay.
Also, during that committee meeting, of which the treasurer and the chairman were present during, there was much discussion among committee members, which include Department of Social Services commissioners, as well as legislators across the state from different counties. And there actually, I think there was an OFA director in the room as well, talking about really the things that we've been talking about here. I felt though it was validating, and I was glad that they were in the room, but talking about the increasing foster care costs and the increasing homelessness rate and how critical of a point we're at statewide. So I don't know. Mr. Treasurer, do you have anything you'd like to add from being present for that discussion?
No, I'm still recovering from the broken heart. It was a painful meeting. The only upside, I guess, was that Misery Loves Company and we're not alone. That what I heard in that room was everybody across the state is facing the same things we're facing. It doesn't make it any less painful, but
No.
It's not unique to Washington County.
I found it validating that somebody else was saying it, that you guys could hear it.
Well, and not to make this any longer than it needs to be, but one of the things I brought up was there's been a lot of shifts pushing cost to the county through safety net at 29% instead of the 75 or 50.
Mhm.
We get an exclusion on our tax cap currently if they raise the retirement system contribution more than 2%. What I brought to Mr. Lucas to consider was proposing another exemption for any new unfunded mandates, the chairman likes to call them. So they're measurable. So new unfunded mandates pushed onto the county from the state are measurable. And we would get another tax cap exclusion should those also break the 2%. Because there's nothing right now to keep the state accountable for the shift of costs from their balance sheet to my balance sheet. At least if you made it reportable on the tax cap, you can at least show your constituents, if you have to break the cap, you have a legitimate conversation to have with them that here's why. It's not through some of the spending choices that we made, it's through cost shifts that the state unburdened themselves with. And they're measurable. So it was just an idea that I threw out for consideration, but it will probably stand no chance of passing because we are they and they will not pass it. So.
It's an extremely valid point, though. Great way to look at how the state does pass on those.
There's
costs.
nothing to hold them accountable now, and I don't know that we ever will.
Okay, I do have a couple of additional items. One is related to daycare funds. I would have spoken last year about additional changes that were coming through from the state in our regulations regarding who is eligible to apply to us for assistance paying for daycare. we have always had funds, federal funds that run through our budget and allow for eligible families or parents to apply to receive funding to help them pay for the cost of childcare. The changes that there has not been a problem with us paying for all of the applicants that are eligible. There's never been an issue with opening their cases because there had been adequate funding. There also was adequate funding in part because we did not have any daycare available in our county. So the two things sort of offset each other, and if a parent can't find a daycare, they're not going to be able to work, and therefore they're not eligible to be daycare assistants. The increases that have widened the door of people that can come to us now are in their level of income. And at this point, it's in excess of 300% of poverty. That's what I was working on when I popped up like a jack in the box over there. I was trying to write down some of the numbers about the federal poverty level. But it is in excess. Currently, a household of 4 could have an income level of over $108,000 and still be eligible for a daycare grant. In that, we are also required to pay for up to 80 absences per year. So a family could be receiving assistance and have a child enrolled. That child could not go to that daycare up to 80 times, whether it be about sickness or transportation or whatever the other instances are, and we continue to be required to pay, and they continue to be eligible. And then also, we are required to guarantee the daycare payment for a period of 12 months when we open the case. And that, I should also mention, is an option. We were also provided the opportunity to guarantee it for 24 months, over which I said we absolutely were not going to do that. So though when these things came down the pike, I would have said to you, this is not going to be good. I'm worried that at some point we may not have enough funds. And at that point, I will come back to you and talk to you about what that risk is. So every month we look at the cases that we have opened, what our spending trend has been, and plot that out for the remaining 12 months if that person is eligible, come up with what our total will be. And at this point, what we've just found is that if we continue at our current rate, we will not have enough funding to pay for all of those cases without having local dollars added in. And at this point, that number is around $250,000. So I want to make you aware that we're at that tipping point. What I am going to do is let the state know that at this point, unless they allocate anything additional to us, and we do have a caveat for that I want to share with you that's pretty critical in this situation. But unless we see more money, we are going to start a waiting list. We are not going to open any more cases. The downside, aside from what you already would understand, if we're not opening any new cases, get that. But also, when people currently receiving childcare assistance are at the end of their 12 months, we have to do a recertification. Effectively, that is opening a new case. So they could be receiving the funding and then all of a sudden sort of be told we're no longer going to provide that to them if we establish that wait list. So obviously it's working families that is receiving this funding to provide that child care. The caveat is that there is rollover money that should be reallocated to us. And if it is, we will not have a problem, or we don't anticipate a problem at this current standing, our spending trends at this point. The rollover allocation that should be afforded to us is in excess of $1 million. The state should be able to notify counties that money is available. If we could get them to say that to us, we're not going to have an issue on this. What I have seen with other, more generally speaking, larger counties, when they are reaching this tipping point that I'm talking to you about, the state pushes back and says, well, you still have money. You can't stop spending. You've got the money. And we say, we don't they say, no, because we have these guarantees in place, we will get our county to the point where there is no money and they are still obligated if we keep spending at this point. The state really struggles with why that's important. However, they have then gone back to the drawing board, looked at what is available for them to pull from the federal government, and then they have added and increased allocations for those counties that have told them they're at that tipping point. So that's the nuance right now. One, let us have what should be coming to us. You just haven't told us that it's there yet. And even beyond that, if that wasn't available, what I would be saying is now Washington County's in this same boat. You need to reallocate and find more funds of another nature. But I think we're gonna be okay, but I want to make sure that you're aware. And honestly, I'd like to know from you, what is the appetite for at this point? One, do you support me in saying to the state, we're gonna start a wait list unless you give us this money? And two, do you feel like I should be starting a wait list right now until we get notification from them about that money? Or should we let this ride thinking they usually come through, so they probably will?
What's your preference? Waitlist?
I want to certainly be able to give a very strong message. But I don't know who those applications are, and those are the people that are gonna be calling you guys.
And then we just refer them back to you. That's how that works. As you know so well.
If you create the wait list, you mentioned that people who are getting services now will eventually lose it. Are they gonna go to the back of the wait list or the front of the wait list?
I believe from what I've been told, it would then be the back. There's no guarantee. There isn't anything that would give them preference over new applicants at that point.
If federal funding through the state dries up, I think having a wait list would be good for the county, because now you have already entered into an agreement, and now we have to finance even more if federal funds dry up. Or if the state doesn't have the money to pull from federal sources, you're just gonna pass the cost on to the county, and if all of a sudden now you open 8 more cases up, it'll put us in a more precarious situation.
Are the grants scaled to their income?
No. The grants are for the maximum state aid rate of the, if they're in a center, a daycare center, it's what that rate is. There's a very low percentage that the family is responsible for. And again, with that opening the door, and this governor in particular is very vocal and supportive of childcare being provided, to the point that I think we're going to have a universal childcare grant before too awfully long. And hopefully at that point, if that were to happen, it is not through DSS. Because this is way out of our bracket. This is well beyond serving people that are, vulnerable citizens. I can't remember the question you asked
So
me.
the grant scale.
No, the grant would be whatever the cost is essentially. And if it's an in-home provider, it would be what they say their rate is. And then the families may be a portion, like say a 10% family share, but that also, as things were widening up, this is what I was going for. That also has been skewed back to where families have very little responsibility to pay. It could be $1.
So you're quick on the envelope, about $100,000 earner with enough kids. How much is it that they get for 12 months for the in-home daycare?
That is not, I can't say that to you right now. I may have.
Is it a grant per kid or a?
It is essentially that we will receive the bills from the daycare provider and pay them. And I think anybody that's familiar with having a child that needs daycare, it's a lot of money. They don't have to even say what we're paying per month right now. But, it's easily $200 a week for people to have a child in a daycare center.
Over 300.
And when coming to the home would be even.
I don't think there are any that come to the home,
Okay.
but if you bring them to somebody else's home, that's
I
providing
saw
it in
that.
their
Gotcha.
home, yeah.
Yeah.
Otherwise, we're at need.
Thank you. That would be cheaper to get in than any.
Especially if they were homeless.
So we could always, you could always go with the waiting list concept. And then you can withdraw that at some point in time, should they say they're gonna come through with the money, right? That'd be the game plan.
I could. I'm not sure, but can check. If you were to order that anybody that loses their coverage during this period of a wait list should be prioritized in some way to then be reopened, we could make that be a caveat as well.
Can the county make prioritizations or is this a federal state?
There once was a time where we submitted our daycare plan and we said who would be prioritized. And that was in the past done by income, done by whether they were doing it to work or whether they were doing it so that they were able to pursue higher education. It used to be about their income level. So many of those things have just been removed because of the increasing requirements now. I can say it and go one more month.
So the option is you write a letter saying we're gonna start a wait list, right? The second part of that is you start the wait list. The third part of that is you send a letter saying, we're not gonna do a wait list until further notice.
I'm not gonna say that to them. I would still say that it is under review from our board.
Okay.
And that the direction that we are going to take without any further funding is to establish a wait list.
I like that. Do it.
Questions, call the governor's office at 518. I'm serious, put the
Yeah.
governor's office number on there. It's their program. It's her
You're
program.
saying if we have to communicate that out to the families.
Yeah,
Yeah.
We're the agent for them.
exactly.
So Sue, is that a motion?
That's a motion.
I'll second it.
Sir Hall.
Thank you, sir.
Thank you.
All in favor?
Aye.
It passes.
Okay.
Get to writing.
All right, got it. I have one more thing. This was the other thing that Al referred to. You have already been generous enough to add more funding into the 2024 budget for DSS to cover shortfalls. We are currently looking and projecting that there is still going to be an overall shortfall. It is due to that increased cost in the safety net, which is that 71.29% that pays for people who are either already in a home and are eligible for temporary assistance, or the bigger fact of this is the people that are homeless and we are paying for. That is really where the cost has skyrocketed, as well as the CSE, the Committee on Special Education, foster care payments, and then also state chargebacks. Currently, we have received a $34,000 bill that really is from placement time of a juvenile from 2023. So that's we've said when we go through the budget, we can either set this money there and never know when it's going to be needed, or just know that we'll get tagged on this. We did get a $34,000 bill come through. So I think we're looking at less than $200,000, but we're trickling it out. And Al, you were going to continue working with us on this?
Much larger number than
No, overall, completely overall.
safety net needs 1.1 million.
Yes, but we have money left in some other accounts.
So that's taking up the reserves and any contingency, and you're looking at it as 200 more, but Al says before we can use old money.
is what we're.
Well, I would be a very happy man if the shortage was at 1.1 and she has other sources to trickle into that.
So we're gonna work together on
We
what
are.
that number is, and that'll go to finance as well.
Again, it would be unfair to ask you to bring a number today. For a conversation that happened at 8:30 this morning.
Yes. I have good news. It's minimal, but I have some.
I thought that was good news, because it's 200 million.
We were just notified, last week, and I had to sign an attestation due by yesterday to say that we were going to try to use the funds, but, of the state passing through $25,000 to us, which we must make a plan to, spend by the end of June, I believe it is for this purpose, but it's around, they have four very specific purposes related to recruitment of foster homes and retention of foster homes. So we're trying to come up with a plan that we could put in place. See what that would cost us if it's something we could get in, under that amount. We would be doing that. In all likelihood, I'd be coming to you next month, talking to you about the procurement process. If we were able to do this, but they've thrown out $25,000 to help us recruit. My preference would have been for them to keep that. Because they gave $25,000 flat to every county to include New York City, for the state police. Keep that money and do a statewide campaign.
Supervisor.
You see your advertising in papers.
Mhm.
How's that going? Are you getting responses?
Yeah, there's a trickle that comes to us, and generally the first time that somebody lets us know they're interested, they probably thought about it several times before. They'll probably continue thinking about it, and maybe somewhere a few months down the road, we'll be able to actually get them into training. But we always have that going, and I do think that it's been successful for us. It's slow.
At that point, you just advertise in a couple outlets. You're talking almost $1,000 a week just to put out a couple of quarter-page ads.
I want to do a commercial.
I'm taking alarm and I approve this message.
I mean, the places that we compete with are doing commercials. They're running on the morning news. I've seen that from Together for Youth, which had been Berkshire Farms, and I've seen it for Northern Rivers, which is a combination of two other voluntary agencies that formed together. So for me, if we have to come up with something very quickly to spend this out, I'm thinking that could be it, something very basic.
You ever considered social media targeted ads?
We have done that already with the ARPA funds. Yes.
Wow, that's expensive. You get a better outreach.
Yes, we didn't find it to actually pan out greatly for us. We're currently with the ARPA funds that we had, we have continued through 25, I think, and 26 to have some radio ads as well as some newspaper ads. But yes, we did do that, but we didn't get calls for it.
How long do you do it for?
I believe it was. I think that we did it for a period of a full year, but it could have been 6 months. I would have to verify.
Did that for you?
At the time that we would have been talking about it related to the procurement process, I would have shared that information here. It is not fresh for me right now. I think that at the time, I remember you saying, yes, that's who you were aware of. I can get that, I can dig back out for that.
Thank you very much, Tammy.
You're welcome.
Next, we have advertising.
Oh,
Yeah.
use social media.
Oh, yeah, just use that, yeah.
Yeah. Yeah, you put it in commercial.
Target.
Fine.
First thing I have on the agenda is we'd like to apply for two separate grants. The first one, we've used before, it's the Walmart Foundation, and that's not to exceed, they award up to $5,000. We'd like to use that to enhance our emergency preparedness, program, so I'm just looking for permission to apply for that grant.
Second.
All in favor?
Aye.
Sorry. Pass.
The second one is called the CHIN program. It's Children and Youth with Special Healthcare Needs. The grant period, it's a 5-year grant period, from 10/1/25 through 9/30/30. The annual award, amount is $57,916. And it's really more of like a service coordination, grant. It is something that many of the other counties in the state receive. It's not one that we have accepted to receive in the past. But I do think it's important moving forward that we apply or accept this grant. I do have to sign a letter of interest or a letter of intent by mid-March. And I do have a call with the New York State Department of Health next week to, discuss the grant in more depth. So I'm just looking for permission to sign that letter of intent, so we can move forward. Again, the grant doesn't start until 10/1.
I'll make that motion for discussion. Second.
Why haven't we accepted in the discussion? Why haven't we accepted it in previous years? I say we haven't.
Yeah, because in previous years, there was the conception that there was the work plan itself didn't really meet what we were looking to accomplish, but at this point, we do feel like it is something that we want to move forward with to help these families get what they need. Would be serving the children from birth through 21 and really be more of a service coordination role that we would be helping them and referring them out to services that they require.
How much workload do you think that's gonna add to staff?
The grant itself requires that you allocate a half of an FTE to the grant, which we're hoping to be able to use our current staff to do that.
Okay, that was my question. You got that, Chief. Okay.
Yes.
Any more discussion? All in favor?
Aye.
The next item, I spoke about this in previous meetings. We were waiting till we got more towards the end of the fiscal year of 2024 for some final numbers. It looks like our preschool program is going to be over budget by about $456,000. We will have revenue to offset that at the 59.5% of $271,000. So it results in a net cost of about $185,000. That's for preschool. And then our early intervention budget is also going to be over about $168,000. Again, we do get 49% back on that. So it'd be about $82,000 we'd have as a revenue offset with a net cost of about $86,000 to the county. And just talking a little bit more about that, I know I've mentioned it in the past with our preschool program, we do get what's called rate reconciliations. So any child that's sent to a center-based program, those facilities are required to do a cost report. If their costs show more than what they were originally reimbursed, they can submit that, and then we have to make up that difference. So within 2024, we did receive reconciliation bills of about $104,000. And that was going back to actually school year 2021 through 2024. So that is a reason for a partial reason for that overage. So at this point, we do have some money in our budget to offset the overage in preschool. We have about $145,000 in our transportation line that we can move to our tuition line to cover that shortfall. But we don't have the funds available within our early intervention budget to cover the shortfall. So I had passed this along to the budget officer and the treasurer. I don't know if Ally had a chance to even look at it. To know, I know last year the county did one big resolution to cover all of the the overages. I don't know what the plan is for this year, but I wanted to make sure the committee was aware that we're gonna be requiring funds to make up those accounts.
So we like to use the cleanup resolution for the nickel and dime stuff. Some of the larger big ticket items, you may want to single out and actually take action on separate.
Okay,
And these are bigger ticket. items.
They're bigger ticket.
Okay.
yeah, so I don't know if this would.
So if the committee had a desire to, they could move it to finance, but the number to be seen at finance.
I move finance. Second.
All in favor?
Aye.
Little question or two. Were the reconciliation bills in our budget around that number, or were they out of our bounds of expectation?
Yeah, we don't know when we're going to receive those or how much they're going to be.
Do know in the future we'll be getting reconciliation bills. And do we have a plan for a placeholder of a dollar amount for them?
We don't usually, because we don't want to, we may not get any in one year. It all really depends on when those organizations file their cost reports and when the state then reconciles them and bills us back, for the difference. So we don't usually have a placeholder in there, for those rate reconciliations.
So they're somewhat surprising, or are they part of our expectation and as a resolution for finance?
So there are always ones that we are reactive to and not proactive to, because there's literally no way to know. And we've seen the numbers all over. Some are minimal and we push them off, and some are not so minimal.
Right, I know one of the big ones we got this year was for one of our centers, and it was $48,000. That was just one rate reconciliation that we got, in 2024, so it's really like an unknown, of when we're gonna get those and what the amount's gonna be.
Right, thank you.
I mean, we could levy for it.
Yes.
It's to Al's point, it could be 0 in 1 year and
Mhm.
or something. another.
When you hear me lecture over and over and over again about fund balance, that is why.
That's where it comes from. Absolutely.
So it all depends on how we, in finance, how we want to manage things like this. We
It's
can,
totally unknown stuff.
yeah, we can do status quo, or we can put a line item in there and say, we're gonna put X, and if it's there, if it's not, if you capture it, those, there's different ways of doing it, whatever else.
And 24 is shaping up to be a very sad year between the number that you're gonna see for assigned council, public health and social services, 3 areas of which we are literally carrying out state mandated services. The total, my rough estimate total of 2.5 to 3 million over those 3 programs that we had no control.
More fun in finance.
More fun finding.
I didn't mean to slow you down.
No, that's okay. I just have a couple things under program updates. We have put out our rabies clinic schedule for 2025, and I've made copies for everyone. It is on our website as well. So I can leave these here for anybody that wants to grab one and bring it back to their towns. So that's one thing I have. And then we were notified the other day about the RAM clinic coming back to Hudson Falls School. It's the remote area medical clinic. They offer dental, vision care, and medical care. It's going to be April 12th and 13th. And I have flyers on that as well, if you want to hang those up as well. And then they're always looking for volunteers, both on the clinical side and non-clinical people. So I made copies of those as well, if there's anybody in your community that would like to volunteer. And all of the contact information is on here and how they would register for that. And then the other, and I did make it in Spanish, just in case it was available. So I printed those out as well, in case those wanted any hung up.
And I saw your rabies on social media. Is the mobile help that went on social media as well?
We can share it on our Facebook page. Normally, we wouldn't put it on the county website because it's not something that we're.
Because I think when you put your rabies one out, I'm happy to continue to share that.
Okay.
with-
Yeah, we can do that. Yeah, we can definitely put this one out there. Okay.
So we just want to clarify, there's no registration for participants in the
Nope,
clinic?
just the volunteers.
Volunteer. And to collaborate on that, having volunteered at this multiple times, it's incredible to watch the amount of people coming through, that they're walking out with eyeglasses. They've discovered eye cancer that they didn't know they had. There's all kinds of things that are going into it. Or dentists or vision care.
Yeah.
That's an incredible event. All worth volunteering at and spread the word. Because they do a
Yeah.
great job.
And there are opportunities to table as well. So if there's organizations, community-based organizations that want to table, there's a way you can register for that. Public health will be there, at least one of the days. So just for your information for that as well.
And then the last thing that I have, is public health partners with Glens Falls Hospital on our Commit to Quit program, for tobacco cessation. Glens Falls Hospital does have a grant through the North Country Nicotine Consultants, and they would like to purchase like a tobacco cessation kit to put together to hand out to people. And some of those items, we'd like to have the county logo on and our Commit to Quit. We wouldn't be purchasing the items, but I wanted to make sure we are okay with having our logo on those.
What is in a cessation care?
So the cessation kit, I have that here. It would be things like,
Cigarette?
no, we offer that, we do, that is a different program, a different avenue they would use to actually get like the medication and things like that, through the hospital. This would be like a stress ball, mints, toothpicks, things like that, fidgety things that they say help people, quit. So it would be a kit like that, that would be available to be handed out to people with the program. So just looking for permission to use that county logo on those items.
I make a motion to pass that resolution.
Second.
Supervisor Hovind, Supervisor Wilson. Any further discussion?
Daryl, did you know what was in a cessation kit prior to that question?
I did not.
Okay. Just want to make sure.
I suspected there was a stress ball in there somewhere.
There must be apps for that, right?
Yeah.
So
So, Jan, you use out at the fair as well? You have a
We could have
To
those
give
put
it
there,
fair.
yep, if we have some left at that point.
we haven't voted yet, so all in
discussion.
favor? or-
Aye.
Aye.
That was my discussion. That's all.
That's all I have.
Sounds very similar to a legislator's stress.
Yeah, it could be. Finance officer stress.
Probably not as involved.
We could probably all use one.
Kick that, Mark.
Thank you.
Thank you.
Keep the interns coming.
Yes.
Get back for another show.
Next, mental health.
All right.
Good morning, everyone.
Morning.
First thing I'd like to do is I'd like to introduce Linda Wright. She's our deputy director. And some of you may know Linda, some of you may not. We recently had a standing meeting that we have among the directors of community services in the Capital District. And we meet regularly with OMH and OASS and OPWDD. And they moved their meeting, which is a standing meeting, to the fourth Wednesday of each month, 10 a.m. So I may be running into some conflicts at times, and Linda may be coming presenting our items. You know, this is the last Wednesday, I believe, so it's not always the fourth Wednesday. Sometimes this gets on the fifth. And I'll try to be here as much as I can and we can get those meetings as well. But we may be juggling a little bit, so you may see a little bit more. And then thank you, Linda, for that. All right. So on to my business item here. Included in resolution request in your packet. For a budget amendment for 24, because it's my understanding we can still amend 24.
Yes, sir.
And that this is actually our last opportunity to do so. This is for the competency restoration expenses. Last year, Washington County budgeted 200,000 for this line, and our actual expenditures came in at 450,273. So we need to do an amendment to cover these expenses. I think everyone's pretty aware at this point, but these are for felony level offenders who are found to be not competent to stand trial, go to a state facility, the state charges back to the county. It's about $1,400 a day now per person. And it's mandated expenses, they're a result of court orders. We did not put a budget line for this at Al's request, but I assume again, finance determines where to take this from, fund balance.
Motion to move to finance.
Thank you. All in favor? Any discussion?
Give a second.
Right, just let the committee know this was a big discussion this week down at the NISAC conference. While this $250,000 doesn't please me, again, under the category of misery loves company, there were other counties that were putting numbers that were significantly ridiculous. There was one county that reported that they have an individual in this restoration service for 12 years. They've been paying $1,000 a day, for 12 years for a sort of person that, so they are introducing legislation. Now, there's legislation being sponsored by two assemblymen that will give the ability to take them from this, we do the 730 competency.
Yeah.
And move it into a 90 something. There's another place that they can put some of these people that are clearly not restorative.
Yeah,
So there's a legislation that's being submitted that to kind of help relieve some of this burden from the counties. This used to be funded 50% by the state. This is another one of those cost shifts that we now bear 100% of this burden. And we have no control again over who's sent, how long they're sent, when they're released. So I just wanted to point out that this came up as a pretty significant item on NISAC's radar because of the impact on the county statewide. And when I heard about the county that had someone in there for 12 years, that is outrageous.
Yeah, there is a process if somebody is in for an extended period of time, they call it Jackson relief. It's related to a Supreme Court decision that says that you can't hold somebody if they're not restorable. You can't hold them in this restoration process. It's just unconstitutional. So that they can be transferred to a civil status where they get transferred to a civil facility like Capital District Psychiatric Center. And then there's no longer a charge back to the counties.
And there's one county trying to send a very strong message, and they've issued a notice that they will now be paying these bills. I think that they're going to be very unsuccessful in that, but at least it sends a message that this is nonsense.
Yeah.
Not the process of sending somebody isn't nonsense, but you can't tell me it takes 12 years to determine if somebody can understand what they're being charged. That's just not realistic.
Just for discussion, how much more is it for regular incarceration, or less is it for regular incarceration?
Substantially.
Right. And
To become an inpatient, my understanding is the cost is significant.
Incarceration or inpatient, I'm not sure what you're saying.
If they're taken out of the 730 competency into another category.
Civil facility.
Is
Yeah,
this
I would think it would be less, but I'm not really sure because,
But there's funding
each
for
of the facilities just have, medical staff, psychiatry.
but that's not 100% county share in those.
maybe this could even be the same, it's not on our ticket.
Not on your ticket.
A motion to move to finance has been made. Any further discussion? All in favor?
Aye.
Passes.
I did have one other item. You guys got that across. Dan was down that way. Tree coming that way. We are also in receipt of some funding from the New York State Office of Mental Health, 100% funding. In the amount of $85,718. The Office of Mental Health is hoping to develop some court-based mental health navigator services throughout the state. And in some way, the development of this may help to reduce our competency examination
Feels
costs.
like it could, right?
This would be somebody who would be reaching out and working with people very early in the court process. So being able to work with people, help them understand the process and those kind of things may get ahead a little bit, or at least for a few of the folks. But anyway, what we'd like to do is request a budget amendment to 25 budget to bring these funds into our.
I'll make a motion to move to finance.
Motion by Supervisor Wilson. Scott, second. Any discussion on this?
Is there a driver on your staff for this, though? If you get into this, what's the workload to staff to incorporate this navigator?
So what we did is we pulled together a little work group. We included the district attorney, public defender's office, alternative sentencing. Sue, you were part of that. Can't remember if we had anybody else part of that discussion. You recall? No, but in any event, they were all on board with this. There were three options you could apply. You could actually indicate that you wanted funding for clinician level, which was at a higher level of funding, a case manager, who was sort of a medium level funding, or a peer, and that was another tier of funding. And so the team felt that in terms of the local system, that a peer would fit well. And so this is funding for, it would actually be a peer. This would be somebody who maybe has had a history of mental health issues and maybe even court involvement, and that they would be somebody who could easily relate to individuals and be able to assist them in navigating the court process.
So ultimately, is this going to change your staffing pattern?
No, but to your question, what we would be looking to do is to contract this out. So this would be contracted to one of our contract agencies, just like most of our other services.
Okay, thank you.
And to that end, I did have a conversation with Barb Birch about the procurement, and maybe it would be possible, I don't know if the committee would be favorable to, we're not sure exactly what we're doing as to whether we would need an RFP. So is it possible we could, if we determine that we want to slide it into one of our current contracts, like we have a contract with an agency that is a peer-run agency, that's what they do. They have certified peers on staff. We could slide it into that contract with People USA if there was a waiver of need for an RFP from the committee.
So you would come with a specific vendor that you want to work with, give the committee the reason why you wanted the waiver, and that could be possible. Because we're allowed to give waivers on professional services.
Okay. Is that possible to obtain today?
If that's your recommendation, to work with People USA and they're comfortable that that's better than RFP.
Yeah.
And I guess I would say at this point, I'm not certain that I want to go that direction, because
So you would come when you have the specific vendor.
it's also possible we could, with the permission of the committee, do a joint RFP with county. Sometimes we've done this.
Which was gonna be my question to you, because I'm assuming because you're several counties, they have awards similar to
They have an award similar, so we could do a joint RFP. Again, for two separate things, but it could be one RFP through Warren County on behalf of both counties.
And
That would
Be a
actually be
separate
my
motion.
recommendation, probably.
Yeah, I believe that would be
So-
separate.
So should we close or determine the motion, move to finance first, and then discuss the next step?
Yeah,
Or do we even need to discuss the next step at this point?
I have a question before you do that. If you don't mind. This is 100% state finance. Is there a
It's
chance
ongoing funding added
that's
to
no
our-
longer 100% in the future?
it,
This one will be 100%.
it should be 100% ongoing.
Forever and
Most
an
of
eye,
our
Al?
100%.
There's a chance. it
No,
could
because
be.
it's always subject to appropriations.
So there's a chance we could end up putting some of this bill ourselves in the future.
If this program continues.
So can you amend, be willing to amend your resolution to say until state aid is no longer at 100%?
Contingent upon funding.
I would like that. Otherwise I can't support it.
I will
I
amend
don't like
my
at the beginning.
motion.
Based on what I'm reading.
to also read contingent upon state aid.
So amended motion, any further discussion?
Maybe a second.
Second.
Second, okay. Does an amended motion have to be seconded?
Hey,
Interesting.
you vote on
Yeah,
it.
you
then.
vote on
We're gonna vote on the amendment.
Oh. So, any discussion on the amendment to the motion? All in favor of the amendment to the motion?
Aye.
Now, are we ready to vote on the amended motion
Finance.
to move to finance? Any further discussion on that? All in favor?
Aye.
And do we need to discuss the process of staffing or
At this
done at this point?
So the RFP, the idea of a joint RFP, do I need a resolution to do that? Or that would only be once we issue the RFP?
At this point, you only need to come back if you have specific action you need at this point.
Is that specific action to go ahead and do the RFP though? Can I work with Warren County and develop a RFP?
Yeah, and you bring it back to the committee, right?
Yeah.
Or we voted to take it to finance, so can you just bring the RFP to finance?
The budget's going to finance. He's looking for permission to go RFP through Warren County. As a joint
RFP.
procurement for both counties.
That way, if People USA applies, they apply. Maybe if they don't, then maybe somebody else can help.
He'd like to leverage both awards into one contract.
Yeah, I'd like that
Yeah.
motion.
I'll second.
For discussion, any contracts you do with like USA, can you terminate them if funding does dry up, or are we gonna be locked in perpetuity with the contract?
That's actually standard language in all of our state.
They all have extra
contracts.
clauses, everyone.
Yeah, that's actually pretty much what you just said, standard language, our state aid contracts, that it's contingent on the receipt of the state funding.
Any further discussion? All in favor?
Aye.
Motion passes.
That's all I
All
have.
right, sir. Hope you got everything you need.
So, is there any further business to be brought forward today? Then we have a motion to adjourn?
Second.
We are adjourned.